Okay, welcome to today's webinar, 211, a tool for alleviating poverty. My name is Natasha Pay. I'm a community animator for Vibrant Communities Canada, and I'm here today with Bill Morris, Karen Milligan, and Geraldine Dressler. I'd like to start off the call today by introducing our speakers. So first off, I'm educated in the fine arts. Bill's work as an artist focused on large-scale architectural installations. An eviction notice changed everything. Bill's volunteer involvement with various housing organizations eventually evolved into an unintended 30-plus year career as an advocate for affordable housing and social inclusion. Bill's been with United Way Centraide Canada since 2002 and is the National Director of Public Policy, who is formerly the Manager of Government Relation and Communications for the Cooperative Housing Federation of Canada, and prior to that, the Director of Organization for the Federation of Metro Tenants Associations in Toronto. Karen is the Executive Director for Ontario 211 Services, the governance organization for 211 services in Ontario. Working with 211 service providers, local United Way organizations, provincial and regional service providers and networks, and government funders and decision makers, Karen is responsible for leading the development of a fully integrated, high performance and efficient 211 system that benefits all Ontarians. Prior to her work with 211, Karen spent several years with the United Way Ottawa in a variety of roles, including involvement with the community-wide initiatives around homelessness, youth addiction, employment for newcomers, and people with disabilities, as well as successful aging strategies. Karen is an active volunteer and currently serves as the chair of the board for Mills Community Support in Lanark County, where she lives with her husband and 2 teenage girls. And finally, you'll see on the screen Geraldine, who is the Executive Director at the Distress Centre of Calgary. The Distress Centre ensures everyone has a place to turn in a time of crisis by providing 24-hour crisis support, professional counseling, and 211 referrals, all at no cost. Geraldine began her work with the Distress Centre as a crisis line volunteer from 2001 to 2003. She rejoined the team as an employee in 2007. She is an AIR certified information and referral specialist and sits on the Inform Canada board. Geraldine holds a master's in social work from the University of Calgary with a specialization in leadership and human services. So with all of that on our belts here today, thank you so much for joining us, Bill, Karen, and Geraldine, and thank you for being on our broadcast. I'll hand it over to you now.
Thanks so much, and welcome everyone. It's Bill Morris. So get us underway and provide a brief overview of 211, what it is, how it began, who it serves, and the current status. In many respects, 211 is a product of collaboration, and I'll just ask whoever's using the slides to move us to the next one, please. Thanks. Okay, so the mission of 211 is really to connect need and help. It's designed to try and ensure that Canadians have an available and obvious way in which to find information about human services and get navigational support. Originally, it was conceived around the telephone number 211, but today 211 is actually a multi-channel service. We still run the helpline and get well over 500,000 calls each year. The line is staffed by certified professionals, and we really take quality as an important hallmark of 211 service. So there's a whole certification system that underpins 211. But the growth in 211 and now the way that most people access 211 is actually online. And so the searchable 211 websites and increasingly text and chat are important channels as well. Next, please. The problem 211 attempts to solve is the challenge that's inherent in our very rich and diverse human services system. It's sometimes a challenge for people to know who does what services are offered where, and in times of need, many people find it difficult to determine where to turn for help. 211 is designed to simplify that by cutting through that maze that many people face as a real challenge. All that someone needing help needs to know is that if they call 211, they can connect to that larger, much larger set of service providers, programs, and community resources that are out there to provide help. This is the important social innovation is really simplifying the human services system and supporting the human services system so that people who are in need are able to find what they are looking for as quickly as possible. And in that regard, it's important to recognize that 211 is a client-centered service. We don't play favorites. 211 is purely focused on meeting the needs of the person who contacts 211 looking for help. There's an assessment done, an initial assessment done of what the caller or the person who is, if it's a direct transaction, what's needed, and then the referrals are provided. If someone is self-serving using the internet, again, we don't weight those services in terms of particular favorites. People can search based on their needs through the websites and find the services that are available. The key here is making sure that there's trust in the information that's provided, that there's a high level of accuracy, and that the information that's provided through 211 is as up to date and as accurate as possible. The internet is a wonderful place, but the challenge that many people have is what can we trust, what can we rely on? And 211 attempts to ensure that there's authoritative information about services and programs. Next, please. So 211 builds on some existing infrastructure that had been in place for many years. In many communities, there were various helplines and there were various directories. I know that when I started many years ago at the Federation of Metro Tenants, I was given the directory of services in Toronto, and it was generally referred to as the Bible. And it was invaluable for people on the front lines because that allowed us to assist others in terms of providing access to the various services and programs that we didn't offer. So 211 builds on that history of information referral in Canada, the standards, but the innovation actually began in Atlanta, Georgia. That was the first community in the world to implement 211, really drawing on the experience of 911 for emergency services, having one number that people could call. That was the key innovation. What we did in Canada was then take that and build a national vision and partnership around it, building on the relationships between United Way and information referral providers to come up with this vision that all Canadians should have access any time of the day or night to multilingual service in any way they choose, be it phone, text, online. And this is enabled, of course, by technology. 3-digit dialing, that innovation of 911 that dates back to the 1950s, but computerized databases where we bring together all those services and programs in one place, plus call center technology and increasingly the internet. Those are the real keys behind it and the DNA of this social innovation. Next slide, please. So 211 is designed for everybody. We get a wide range of people that need help. But I think it's safe to say that the bulk of the people that contact 211 fall into kind of 3 buckets. But certainly people that call and search for help for themselves or for their families. The preponderance are low income. We get people that face mental health challenges or addiction challenges, and they can come from any socioeconomic strata. But when we look at what people are searching for, a lot of it's around basic needs. A lot of it's about food. A lot of it's about income. A lot of it's about housing, and a lot of it's about health. Those are really the keys, and so the demographic who uses 211 is people in poverty. So hence the kind of 211 is a tool for alleviating poverty by providing that access. Over 2/3 are women, again, not surprisingly. A disproportionate number are newcomers to Canada who have manifold needs when they arrive here. And a lot of people come with more than one need. People might, have a presenting need as hunger, but very often underlying that are other issues of poverty and other issues that are all around the social determinants. So we see multiple needs in many cases. And again, a high proportion have government assistance as their primary source of income. But there's two other really important users and beneficiaries of 211, frontline agencies and workers who come into contact with people in the course of their work are super users of 211. So agency staff, police, paramedics, doctors, clergy, all those people use 211 to help them do their work. So 211 is really a tool both on the kind of retail side of people themselves who are trying to help, but also for people who are working professionally to assist them in doing as good a job as they can. And lastly, I want to point out that the data that we collect as part of delivering that service, or that the 211 system collects as part of delivering that service, is increasingly a value proposition in of itself, because it provides a snapshot in terms of the need and demand for human services almost on a real-time basis, which is unparalleled. So we could, for example, track as Syrian refugees arrived, their need for housing, then their need for language training and jobs, all those kinds of things in real time, and provide that information to inform good decision making. Next slide, please. So the current status of 211 reaches about 62% of Canadians today in terms of full service. And by full service, we mean online as well as telephone service. There are some places in Canada, Saskatchewan and Manitoba, for example, that don't yet have phone service, but that have online service. And increasingly, we see online service coming before telephone service, because telephone service is expensive. But I'll point out in terms of this chart that, of course, Ontario and Nova Scotia have province-wide service, full service currently. And we'll see some significant movements in this year. About 5 million additional Canadians will gain access to full service of 211. Saskatchewan will light up the telephone service around April. And in Quebec, the people living in the greater metropolitan area of Montreal will also gain service in around April. So that will move us up to nearly 70% of Canadians having full service 211, and every major city in Canada having full service aside from Winnipeg, which has online service presently. Next slide, please. So at this point, I'll pass off to Karen Milligan. And again, we'll come back to questions and discussion at the end of this. Karen, over to you.
Thank you, Bill, and a great introduction. I think what you've heard from Bill is sort of the core of 211 and how it came about, what it was meant to provide solutions to. And what I'll talk about over the next few slides is really how does 211 work in terms of poverty alleviation, and what capacities can be leveraged in order to help with poverty alleviation at a local, regional, and provincial perspective. A national perspective. So this slide is meant to really highlight what some of the capacities are as they relate to poverty alleviation. And you heard Bill talk about the professional information assessment and referral staff, what we now call community navigators, because certainly I think people are familiar with that language, and certainly in relation to the health work that is going on. So when we talk about professional and highly trained staff, Bill mentioned previously that there are standards in place North America-wide that govern this 211 and information and referral sector. And that body is called AIRS. You heard it alluded to in Geraldine's introduction as well. But needless to say, those standards are in place and are really the basis of the service that's delivered both by phone and online. So in relation to poverty, really those staff are highly trained to answer calls, in particular from vulnerable populations, to both probe with them on the needs that they have and understand what, beyond what the issue is that they're presenting, what other factors may be going on that they can get some support for or get connected to programs for. So specifically in this case around poverty alleviation. What we've done as well in this chart is tried to describe both the core functions, what we do on a day-to-day basis in terms of our 211 work, but also what kinds of value-add functions the 211 system can provide and have been providing through a variety of different projects and specialty lines and services that have been taken up through partnerships across the country. So I think the first column there speaks to like case management, and in particular, there's some good examples that point to this, but some additional follow-up and more of a like case management model is possible because of the starting point in terms of the understanding of the services that exist and many of them being very complex needs that need to be addressed, working with people over time, obviously where there's permission to do so, to continue to connect with them and continue to work with them as their needs evolve and as they work through, as I say, what are some often very complex needs. Advocacy and follow-up. This piece is highlighted a little bit through the work that we did with Green Shield at a national level, but in our day-to-day work, we do identify those callers that either because of reduced capacity or because of a level of stress that prevents them from taking the next step, that we will often advocate on their behalf, either directly with the service that they're needing or in some cases through a three-way conversation. And as well, the follow-up after the fact to make sure that they were successful in connecting and to identify whether there were other needs that we can help them with. This is a small percentage of our callers typically, but it is part of our standards, and it is something that ongoing we're looking at flagging those who require that additional support. To the right, I think through several of our partnerships across the country, we've been able to demonstrate that 211 can be used as a common intake point, assessment, appointment bookings for poverty-related programs, such as the ones that are listed on the screen. And in many communities, there are things like school supply programs, Christmas hampers, tax preparation clinics that are often unknown if each of the local organizations had to go about it on their own, and they change dramatically depending on how much capacity they have to deliver those in each individual area. So in many of these programs, 211 has been used as the common intake point. Again, easy to remember number, available 24/7, but really just pointing people to where that support is, and in some cases, scheduling appointments or providing an initial assessment that can then ease the process for those who are delivering on those things at the agency level. Bill spoke to this quite eloquently, but I think the 24/7 access piece is pretty core to our 211 world, and it's something that in many ways is not available elsewhere in many services and communities. So I think this presents an opportunity for both agencies and individuals looking for help to get the help when they need it in the place that they need it. The 100 languages, and really that's a minimum number of languages. We can both speak to people in whatever their native language is, but we do that in a number of ways. Many of our contact centers have folks working in them that are multilingual. But in addition to that, we have access to trained teleinterpreters, and again, more than 100 languages, but including many of the most popular Canadian Aboriginal languages through a variety of partnerships. So that piece is really key as well, obviously, for communities that have a large number of newcomers, and it's a huge benefit to those trying to navigate their way through a system when neither English or French is possible. So in addition to that, and I mentioned it on the right, there are some organizations that have partnered with us across the country to provide either overnight or overflow support for services only offered during normal business hours. And that happens in a variety of ways, but in some ways it's as simple as some organizations put a voicemail on their line to say, our offices are closed, but if you're looking for help with health, social, government services, please contact 211. What this does, in particular in the overnight hours, as many of you will be aware, in many cases, it's just reducing the stress and dealing with that really initial concern and equipping those people with a plan and information about how they can resolve that particular issue when the lights come on in the morning. Access to the resource database through 211.ca, that is the national site, which then links off to provincial sites. Bill spoke to this, but I think the core of this is in many jurisdictions, almost all jurisdictions, 211 is the most comprehensive source of data for human services. So just the ability to access that resource for, as Bill said, both the public and those working on the front lines. And in relation to that, there are several dozen specialized portals that have been developed for both as internal tools, but also as public tools that leverage the 211 both provincial and national data, but this is resource data that we're talking about, so that data does not have to be duplicated. It can be shared and customized, but we're not recreating the wheel. And the final part here, again, this was spoken to in general, but much of the world of poverty reduction these days relies on evidence and relies on very specific outcomes to have programs funded and to have new programs developed. So what 211 contributes is information about the demographics of the people who are calling, visiting, and chatting and texting, what their needs are, what their unmet needs are, and of course, program and service outcomes. In our systems, we will often collect information both about the 211 experience, but also what they were able to connect to at the end of the line. Did they follow up on the referrals? And if so, did they get the help they needed? In some cases as well, we're also asking about ultimate outcomes. In other words, did your health improve as a result of making those connections to resources? So very quickly, I'm going to provide a few examples or case studies of where 211 is working in the poverty realm, and I'm going to go through this fairly quickly, but again, there'll be time for questions and comments at the end. And excuse me, the one piece that I'll just mention at the beginning is that there is a common theme here, all of those capacities that we've talked about that exist in the 211 system, these are examples of how 211 has been leveraged to help with poverty alleviation in particular in a number of different ways. So the very first one that we'll speak to, there we go, is the partnership with Green Shield Canada. This is a project that is just wrapping up, but it was a 3-year project, again, funded by Green Shield Canada through their Opening Doors to Better Health initiative. Some of you may be familiar with Green Shield, but they are an insurance company and started out as cooperative. So I think they're very community minded and have goals for their corporate responsibility mandate that speak very much to the items that are in front of you. So Green Shield has a desire to build better pathways to health and get people connected to health who are underinsured or uninsured. And this typically speaks to the people who are the working poor. So when the project began, which engaged Ontario 211, United Way Canada, and Find Help in Toronto as the project sponsors, its aims were to both increase awareness of the 211 service as a front door, an easy channel for people to be able to access the help they need, to increase access in general by having, in some cases, navigation assistance, but advocacy and follow-up to improve the likelihood of people connecting to those services. And then expanding the impact of both 211 and those end-of-the-line services on the individuals that it's intended to serve. Much of this work very much was founded in Green Shield's belief both in the social determinants of health, but also in leveraging what exists within the social infrastructure to, rather than creating a new program or a new service to address their particular interests. So they were very pleased that 211 existed and happy to help build the capacity in the 211 system to achieve some of their corporate goals. The other thing I'll mention is through this project, we certainly were able to focus quite a bit on both the, excuse me, the data that we talked about and what the impact of the 211 service is on the health outcomes of people through this pilot work, but also work at a national level around creating or beginning to create some national data collections. So that work has been instrumental in moving us forward and building our potential to be a national solution for a variety of different partners. The next one that I'll go through fairly quickly is that 211 is working with MCSS, Ministry of Community and Social Services in Ontario, to support the rollout and launch of Ontario's Basic Income Pilot. And many of you will be familiar with this pilot. 211 Ontario's role in that project is really to provide navigation support to those people who are enrolled in the Basic Income Program. As some of you may know, many of these individuals will have received social assistance in the past and will be accustomed to working with a case manager who then connects them to other services that they are entitled to. So the notion of the Basic Income Pilot is that if you give people an adequate amount of income, then they can certainly identify what other services they need and access them, because there are quite a number of income-related supports available in this whole sector. So this work is helping those people who are part of the pilot find their way if in fact they're not familiar with what exists out there and how to access it. The other thing that we've recently begun to do on their behalf is book appointments for people to local information sessions that are being held in those pilot communities. And we've also assisted with helping to train the enrollment staff, who are ministry staff, regarding how to deal with people with complex needs, how to identify if somebody is in crisis, and some high-level information around protocols, how to deal with those situations. I do believe that MCSS and others recognize the capacity and the skills that exist in the 2-in-1 system, and the familiarity with dealing with these kinds of situations and this particular group of individuals who are struggling to make ends meet. The next example I'll give is, again, many on the line will be familiar with the physician's poverty screening tool that has been developed and rolled out nationally by the Center for Effective Practice. We have recently been involved in a project in Ontario whereby the poverty screening tool is being put into an electronic format and integrated with the electronic medical record. And we are bringing in 2-in-1 resource data through that tool so that physicians know where to refer that person to in terms of community services and support. That work is just being completed in a pilot phase through the local poverty reduction fund. And on the right, you see a referral form that is actually in place in one of our local areas in Ontario, North Simcoe, Muskoka. And there's a physician group that has agreed to pilot this, whereby they will identify what needs exist using the poverty screening tool, but instead of just presenting a list of resources to the patient, they send this referral form through to 2-in-1, and a 2-in-1 agent follows up directly with that individual and connects them to what other services they may need. The last one that I will mention, and then I'll hand over to Geraldine, is really 2-in-1 working in the homelessness, in a particular youth homelessness space. You see a couple of examples in front of you whereby 2-in-1 is being promoted as the front door for youth who don't have a place to stay. And you can obviously see the different images on screen, but the real key is to the right, which is what lies below that front door number. In each of these communities, there is a very detailed and clear protocol that involves many others who are in the youth homelessness serving space. So homeless coordinators, homeless outreach people, if they come in through the front door, there's a clear path to how these people can get help and how this whole network of services below works together to meet the needs of those individuals. So I'm going to hand over now to Geraldine, and she's going to give you a couple of non-Ontario examples to help highlight where 2-in-1 is working in this space.
Great, thank you, Karen. I'm going to talk to you today about one 2-in-1 program's efforts to help alleviate poverty in their community in Calgary. And here at the Distress Centre in Calgary, we've operated the 24-hour crisis line since 1970. Now, 2-in-1 came to Canada in 2001, Toronto first, then Edmonton, and then Calgary launched in 2005. And Distress Centre was seen as a good fit because we already had the 24-hour contact center. As Karen said, that's a critical piece of 2-in-1, is providing that 24-hour service. Now, the basic needs fund that we operate at Distress Centre, and there's a network of different programs, a handful of programs in Calgary that are able to distribute emergency needs assistance and emergency financial needs assistance. It predates 2-in-1, and historically it was kind of operated through the crisis lines and then through the crisis counseling program here at Stress Center. And what we found was that with 211, we had a new opportunity to engage differently with clients in need of emergency financial assistance. So Karen, if you'll take us to the next slide. I'm going to provide a little bit of the context. Basic needs assistance here in Calgary, the demand has grown and it ebbs and flows. We do have a boom and bust economy here in Calgary, of course, with our heavy reliance on energy and oil and gas. So through the cycles of a boom and bust economy, we've seen huge increases in housing costs and utility costs. Many people come to Calgary, especially, of course, in boom times, looking for opportunities, and they leave those support networks that they may have to support them through difficult times behind. And so that creates really complex needs and requiring complex supports. And through the crisis line, where we have volunteers providing that service, which is wonderful, they provide wonderful service to people in crisis, the complexity of the issues and the needs required a professional support. But one person, our Basic Needs Fund coordinator, could not handle the demand. She received calls from, people from all over Calgary and different programs from across Calgary, and couldn't keep up with the demand of the need. Move on to the next slide, Karen. So we were able to move the Basic Needs Fund under the umbrella of our 211 program and the services that we provide within 211. And what we were able to offer through our 211 program was common and consistent intake 24 hours a day. So it didn't matter what time someone was calling. They wouldn't get a voicemail. They wouldn't have to leave a voicemail. They could talk to someone right away, talk to someone live, be able to walk through what was going on for them, and get that assessment that they needed. And regardless of whether or not we had funds in the Basic Needs Fund, because of course demand exceeded the number of funds that we had, or the amount of funds that we had, regardless of that, the caller would receive support for whatever was happening for them. If it wasn't from Distress Center's Basic Needs Fund, perhaps it was from one of the other Basic Needs Fund, or just the general support that we can provide with 211, which is the assessment, the information and referral piece, being able to navigate that complex system of social services. And as I said, especially with the shifting environment, the complexity also shifts, and programs come and programs go pretty quickly. We're also able to offer the follow-up to the caller and check in with them and see how they're doing, if they were able to connect to the services that we referred them to. And we're able to advocate. If there's a government support, for example, again, the complexity of the government supports that are available and accessing those supports and navigating those supports can be really challenging. And if people are in crisis or they're struggling with a mental health issue or an addiction, they often need someone to support them through that process. And in 211, our professional staff are able to do that. And next slide, Karen. Thank you. And recently, and actually as recently as today, we're really excited about this. Our local United Way here in Calgary has developed Canada's first financial empowerment model. And it's a very comprehensive model that takes us beyond addressing emergency financial needs. And 211 is being listed and promoted starting today as the contact to access United Way Calgary's funded financial empowerment initiatives. So this really takes us beyond those emergent situations, and now we can work with people, and we have been working with people when an emergency financial situation presents itself, working with them to see what other supports they can gain access to that might prevent the same situation from happening again. The best example out of this broad spectrum of programs and services that are available under these 6 headings here you see on the slide is our tax clinics. We have a number of programs providing tax clinics here in Calgary, and we can connect callers to that. And that has put, the stats are quite astounding, has put millions of dollars in Calgary back in people's pockets, people who are living on a low income. And we're able to do that because 211 is the one service available in Calgary that is connected to every one of the services that are available underneath these six areas here that you see here. So we're really excited to be moving to that, more of that prevention work and working with callers to get them connected to programs and services that might help prevent crises and emergency situations from arising in the future, or prevent that from happening at all. And with that, I will pass it back to Bill.
And as soon as I take myself off mute, I'm here. Great. Thank you so much, both Geraldine and Karen. There have been a couple of questions, and maybe I'll just kick off by getting at two that have already been submitted. One asks the question about the data availability, the data that's collected. How do people go about accessing that data and making use of it? And so the question asks, are there reports, are there ways of doing that? And yes, most 211 providers in Canada, there are 12 of them, do produce reports, canned reports, but increasingly there's a much more sophisticated way in which data is being collected and presented. And I think I'll pass this over to Karen, since Ontario 211 has been at the forefront building the new community intelligence system. Karen.
Thanks, Bill. So yes, we have done a fair bit of work in Ontario over the last couple of years in building, some of you may be familiar with business intelligence platforms. We've called ours community intelligence, but it virtually is the same thing. It surfaces the data that we have been collecting and managing for years and allows users, and that primarily is stakeholders and funders at the moment, but it allows users to analyze the results and to drill down into the information based on their particular area of interest or expertise or geography. So that community intelligence platform, as I say, is available to our stakeholders in Ontario, but we are and have quite recently added Nova Scotia and Alberta to that platform. So it is growing, and I think it's a really effective tool for both those of us needing to produce reports in the system, but also for policymakers and decision makers to really be able to analyze the information that we are collecting through those interactions.
And Karen, is the best way for those that aren't funders currently or involved in 211 to get at that data? Is the best way to do that to simply contact the 211 in their area and begin to build that relationship in order to gain access?
Absolutely. Yep. And we've engaged across the country with a number of stakeholders in the research, evaluation, and outcomes world. And a lot of those folks are helping to inform how we build this out nationally. But in the interim, until we do have a more public-facing platform for that data, yeah, definitely any one of the 211 providers can help identify the information that's relevant to local communities.
Yeah, I think it's important here to note that the vision for this is a kind of open data vision, that the idea behind 211 is to make information available for public good. And this is really an extension of that, and increasingly I think we'll begin to see as we move out from the initial funders and stakeholders of 211, a more public face for all of this, so that those who are active in this space, be they agencies or organizations trying to get at various issues, that they'll have new tools in terms of this information availability. The next question asks about, and I think makes the important point that the quality of the information that 211 collects is core to delivering good service, but asks about the challenges in smaller and rural communities and how we're attempting to get at that within the 211 system to make sure that the data about the services and programs that are available, the various resources, is as rich and as accurate as possible. Geraldine or Karen, do you want to jump in on that, please?
I could certainly speak to that. Yeah, it's Geraldine. I think we really work, here in Alberta, we're working to expand the 211 service to more of the rural areas. We currently have some of the rural areas covered, but certainly not all of them. And it really comes down to working closely with data partners in the community to get the information that our 211 professional staff need to respond to requests appropriately and to have the information that they need to direct callers and service users to the place that is best within their community to go for support. We do know that there are unmet needs, and that especially in rural communities, and that's the type of information that we collect at 211. We collect a lot of information on needs, but also unmet needs. What needs are unmet within the community, and we can feed that information back to local municipalities, to decision makers, policy makers, and inform them of what the unmet needs are in the communities, especially rural ones. So we're working on the ground, and we're currently populating our entire database with data from across the province. So this is really top of mind for me right now. And we have one of our staff here from Distress Center was in Canmore yesterday, for example, meeting with a broad set of stakeholders in the 211 data that's being implemented and populated into the database right now. So it's really about being on the ground, getting the information from the people who are working in the community every day. And I think also it's important that we talk a lot about 211 being that backup support. What they found during the flood, and this is the Bow Valley here, that's Canmore, Banff, they found during the flood of 2013, they had no supports for their people when they were evacuated. They had no 24-hour call line, nothing. So that's why they're really interested in getting, making sure that 211 is available within their community. But again, we're working very closely with the people on the ground from those rural communities.
Karen, anything to add there? I know that we certainly also engage just the general public. Every 211 website has a place for people to suggest a service or a program, and I know we get lots of suggestions from members of the public about things that we may not yet have come across, but other strategies that were being used.
And I'll speak to this in two ways. I think the first is that some of our work is really around working with our data partners, absolutely, in local communities, but also working directly with agencies that offer these services and programs and improving the channels for them to be able to suggest updates and suggest new listings to be added to our database. I think part of the struggle is always we don't know what we don't know. And so if we create better mechanisms for agencies that are delivering programs to be able to feed that information directly into the 211 system, then that will also improve the completeness and accuracy of the referral or the resource data that we have. The other thing I'll mention very briefly in relation to some more rural and remote communities is there's a study that is going to get underway very shortly with the Rural Ontario Institute to look at the unmet needs data for rural and remote communities that 211 collects, to understand how it can be useful and also how it can be mapped alongside and combined with things like socioeconomic data to draw some conclusions around either the level of services that exist in some of those communities or just difficulties with understanding what exists.
Great. So the next question I see up on the screen, my screen, is from someone who works in a food bank with refugees, many of whom speak Arabic, and the question is whether or not 211 can help them in Arabic, but it also speaks to helping with the cost of housing. And so I can answer the first part. Certainly 211 can help someone in their language of choice, and if Arabic is their language of choice, 211 can do that. Housing is a huge challenge for us, and it's one of the the top reasons why people call 211 or search for services and help on the 211 websites or contact 211 via chat and text, because of course it's a cross-cutting issue for people who are living in poverty. And the challenge that the 211 system has is really in some cases the absence of resources like the kinds of supports that might help someone with the cost of their housing. We do, though, track those unmet needs, but I can tell you that that one is one that pops to the top all the time when we're tracking unmet needs, is the challenges that Canadians have with the high cost of housing. Geraldine or Karen, anything to add just in terms of that issue around housing and housing cost and the way in which 211 works?
I can speak to it. I'll go ahead and then let you have the floor, Karen. I think, there is a huge unmet need there for sure across Canada when it comes to housing. But I think what you get when you call 211 is you will get access to whatever services that are available through a referral. And it's not always about, necessarily finding, we may not have the dollars, through a specific basic needs fund like we do here in Calgary. But the information and referral specialist can work with the caller. What we commonly do, of course, is try to find ways to connect people to services that can alleviate some of the strains in their finances, like referrals to food banks, referrals to ongoing to support, where someone can support that service user in gaining access to as many programs and services as possible to support them on their way. Even if we aren't able to meet the need for housing specifically, we can connect them to supports that hopefully over the long term can get them to a place where they are housed adequately and safely.
Thanks, Geraldine, and very well said. I don't have much to add to that other than the fact that in various parts of Canada, we are working with people like electricity distributors to identify what some of the barriers are for people who are living on low income to both access some of their retrofit programs and things of that nature, and to even find out about those programs. So one of the ways that we can help in terms of housing is by looking at not just the state of housing that they're in, but how can we lessen the overall financial burden, which Geraldine has already talked about. But specifically in Ontario, if people are familiar with the new AFT program, Affordability Fund Trust, it is proposing energy audits and retrofits, including the replacement of some of the major appliances in order to reduce energy consumption, but also in the broader context to ease the burden on people who are struggling to pay their electricity bills. So in some cases, if somebody might say they have a housing issue, and it might be strictly finding housing, but it might also include if they were able to make changes to their existing home, then they might be able to better afford to live there.
Great. So we've got two more questions, and we're going to have to wrap up in a minute or two. So I'm going to just try and summarize those, and maybe Karen or Geraldine can jump in quickly. The first question speaks to the issue of people that don't have access. Those who are really heavily marginalized, highly marginalized, and don't have access to phones, computers, literacy, and transportation, and those types of barriers. Clearly, that is a real challenge, and what we try and do in that regard is work very closely with other service providers and support service providers who are working with very marginalized groups, and in many cases we find those people coming to the 211 system through libraries, through other resources where they are able to access some of those communications channels. Transportation is obviously a huge challenge. I don't know that I have a real easy answer to that. I'll just get to the other question and then come back to Karen and Geraldine. The second question, the last question here, was about specifically what kind of coordination process is there for making access available to First Nations communities and remote communities. Again, I'll just note that we do build relationships with communities of all kinds, including First Nations, and I know Ontario best, but I also know Nunavut in terms of the work that we've been doing there, and the Nunavut site is actually 4 languages that include both of the Innu languages, and there's been a lot of outreach to the community. People may know that about 70% of the population of Nunavut does not have either English or French as their first language, so it's vital to build those relationships and ensure that kind of access. But in other places, what we've been doing is trying to work with people that are really have strong relationships and are good intermediaries with First Nations and Indigenous communities to get at the services and programs in those communities. But we've also specifically worked with those communities about how to do outreach, how to do the kind of marketing in Indigenous communities, so that there's a level of trust. But I'll be the first one to say that building that trust and building those relationships is a very long-term project, but one that we're committed to. Geraldine or Karen, anything to add in the minute or so we have remaining?
I'd love to add just a couple of examples. Sorry, Karen. Just from Alberta. Go ahead. Go ahead, Karen.
Sorry, no, I was just going to highlight that, in fact, not to get into any specific examples, but I think Bill's point is quite valid. We, in many cases, are working very directly with agencies on the ground, with community networks, with poverty reduction tables, to be a solutions finder, but also to act as that front door. I think, again, our desire is to make sure people find what they need quickly and easily, but we wouldn't be able to do that without working in partnership with those who are on the ground.
And if I could quickly just say that in Alberta, we are, in Edmonton as well as in Calgary, we are providing support to the homeless population. In Edmonton, they have a 24/7 crisis diversion team where it is accessed by calling 211. So if someone's concerned about someone who is homeless, they can call 211 to get connected to that team. And here in Calgary, we have a team working out of a storefront, and they're working with the homeless population. And so you can walk in and see someone from our 211 program and work with them to get the support that you need.
Great. Let me maybe pass it back to the organizers and thank the organizers very much for the opportunity to present today.
All right, thank you very much, Bill and Geraldine and Karen. What a fantastic presentation. We've captured all of this, we've recorded the session, and we will be sharing it back with everybody on the line in the next couple of days. And definitely, if you have any partners, colleagues that you'd like to pass this information on to as well, you'll have the link there to share it with them too. So I'll just say, I'll just run us through a couple of quick closing announcements. We would love you to stay in touch with us. Vibrant Communities, Cities Reducing Poverty. You can do that by receiving the latest thinking, news, tools, and resources from the poverty reduction community by subscribing to our bi-monthly newsletter, Cities Connect, or visiting the online learning community for poverty reduction practitioners at www.vibrantcanada.ca. Also, if you enjoyed this webinar, I think it was Karen who was speaking before to the connection with the poverty screening tool. So we're actually going to be having a family physician, Dr. Gary Block, along with Trish Gardner, on the next webinar. Entitled Strengthen Your Poverty Reduction Work, Engaging with the Health Sector. And so they'll be talking all about how the health sector can be a real strength in poverty reduction work at the roundtable, at the service level. So if you are interested in that, February 13th from 1 to 2 p.m. Eastern, we'll send you the registration link in the follow-up. You can also learn with us in person by attending one of our upcoming workshops. There is a Collective Impact 3.0 workshop coming up for collective impact facilitators or anyone working at any level from beginner to advanced to collaboratively come together and help advance the theory and practice of collective impact based on your real world experiences in doing community change work. So this will actually be coming to Edmonton, Alberta, February 28th to March 2nd, 2018. And again, we'll send you that registration in the follow-up. It looked like there were quite a few data interested folks on the line today, so we do have an evaluation master class coming up. There are several one-day workshops being held in cities across the country, featuring our evaluation gurus, Mark Kabaj and Michael Quinn Patton as session facilitators. The week there is March 12th to 16th. I will send you more information about what you'll be learning in that one-day workshop and the registration link in the follow-up. And then finally, if you'd like to move towards from a needs-based approach towards more of an asset-based approach in your community development work, your neighborhood development work, or community health work, we have a 3-day workshop that will teach you the core principles, dive into practice applications, and present local cases where they're having success with ABCD. You'll meet world-renowned trainers Cormac Russell, John McKnight, as well as peers across Canada and the US in Kitchener, Ontario, April 17th to 19th. So we will send you that link in the follow-up. And just a big thank you again to our presenters, Bill, Karen, and Geraldine, and to everybody for participating today. We had lots of great questions coming through the chat box that we did not get to. But we'll be sending you all of the resources and the recording, as well as the PowerPoint presentation from today's call in just a couple of days. So thank you very much, everyone, and have a wonderful afternoon.